What are the most common restorative dental procedures?
Well, there are a lot of procedures that can be done with restorative materials, such as we can fix decay, so we can clean up cavities and put filling material back in the tooth to restore the form and function of the tooth once it's been damaged from tooth decay or acid erosion or other such types of damage. Also, there are bonded veneers or bonding that we can do, aesthetic bonding to recontour, reshape teeth that are unsightly, or if a patient wants a different type of shape to their tooth or look about them, we can do that as well.
How does restorative dentistry enhance aesthetics and functionality?
Restorative dentistry improves function because it allows people to eat again and function with their teeth and speak properly without having pain, for starters, or food that gets lodged into decayed open spaces. So functionally, it's to restore the form of the tooth, the function of the tooth. We remove all the bacteria and decay, and then we replace it with filling material, and that helps to fix these problem areas. Aesthetically, it can remove unsightly decay in the front teeth, especially. It's important to have your social six, especially your front top six teeth, look aesthetic and pleasing for your job, for work, for socialization and such. So we can help you accomplish that with either fillings or cosmetic bonding.
What is the difference between fillings and bonding?
Fillings and bonding are kind of are similar in that you're using restorative or materials, but traditionally what we mean by filling is that there was a decay or a cavity, a problem with the tooth that we had to replace for health reasons. Whereas bonding, people tend to think of that more as cosmetic bonding to improve the aesthetic of teeth. It's usually done in anterior teeth or front teeth, and helps people feel more confident about their smile, and helps them with areas that they want to improve aesthetically by shape, color, that sort of thing.
What does bonding address and what are its challenges?
So bonding can address spaces, small spaces between teeth that people would like to have closed. It can address corners or edges that have been worn or chipped, depending on how the bite comes together. We can place bonding to improve shape. So if you want a different type of a softer looking tooth, or a more feminine rounded look, or a more square or straight look, we can kind of help reshape teeth with bonding, and with some also some reshaping with discs and such, to make a more aesthetic smile for the patient. We can close some of those diastemas that people have, like gaps in between teeth. Some people want those closed and would rather not have orthodontic treatment. So there is a time and place for that as well.
How long does bonding last after reshaping or filling a cavity?
Bonding can last years for some people. It depends on how much they wear their teeth, and if they are wearing a bite plane or a nighttime appliance, a night guard, to help protect that bonding as well. So bonding can last years for people, if it's in the right case. If it's in a tooth wear, worn down dentition and that sort of thing, then there's going to have to be more protective measures taken place to keep that more long term. Or bonding may not be the right solution for that person, depending on their wear patterns. They may have to move teeth orthodontically before they can place restorative material if the wear is severe. But for other people with minor wear, they can be fitted with a night guard or a bite plane that can protect some of this bonding as well. And that can help extend the longevity of the bonding.
What does the bonding procedure involve at Sublime Dentistry?
So in terms of bonding the procedure, we would bring the patient in. It may only take one visit if it's limited number of teeth that we're looking at doing. It could take multiple if there are more teeth. However, what we're going to do is kind of put some etch on the tooth, which helps us bond to the tooth, and then we're going to put the filling material over top, or the resin is what we use to bond the tooth, and we're going to choose a shade, and we're going to help start shape these types of restorations up. We're also going to use a mirror quite a bit with the patient so that we can show them as we're going, this is what we're doing. Do you like this? Do you want this shorter, for example? Do you want it a little bit longer? Would you like it curved more? There are so many little intricacies that people don't even realize until they look in a mirror and see what we've done, and then they can also take part in the process by giving us feedback, and we can help them achieve the shape and the look that they desire. The patient always gets a say in the outcome. We're definitely having them be involved at certain stages in the process so that they can look at what we've accomplished so far, and we can tweak anything that we want to make it as aesthetic as possible for them. We can even revisit it. Sometimes we'll let the patient go home with the new bonding and look at it in the mirror for a couple of days, show their partner, that sort of thing. And then if they, see anything that they want tweaked or changed slightly, then we can address that again at another appointment.
Can bonding be whitened?
No, bonding, once the shade of bonding is placed, it doesn't change with bleaching or anything like that. So we like to pick the color that the patient would like. So if the patient is thinking of bleaching their other teeth, we encourage them to have that procedure done first, and then we can match the bonding to the bleached teeth so that things look smooth and it all matches nicely. Because bonding will not bleach on its own. So if the person wants whiter teeth all around, we suggest that they bleach their natural teeth, and then we match the teeth that we're going to bond to those other natural teeth.
What is the cost of dental bonding at Sublime Dentistry?
Dental bonding can range, depending on the number of surfaces and the location of the tooth in the mouth, somewhere between $300 and $600 per tooth. So that is, it does depend on a number of factors, but generally at Sublime, we follow the Nova Scotia Dental Fee Guide. So our fees are in line with those fees.